Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director Communications and MC here at Gold Learning. Well, we're here again with one of our amazing speakers coming up for our Gold Lactation Online Conference 2024. It is that time. If you have not been on the website yet and have not registered, get it in right now. That's right. Head over. You can pause this video right now. Head over to the website, goldlactation.com. It is going to be an absolutely fabulous event. I'm so excited. It's almost palpable talking to all of our speakers. I feel like the intensity is greater this year, and I don't know what shifted, but I believe that it's partly due to the passion and the trajectory of what our families really need, what they're asking for. So we have to be ready and prepared. Now, one of the big topics that we're going to be diving into, of course, is pharmacology. And here with me today is Dr. Nour El Hoda Ezzeddine. Welcome, Dr. Nour. It's so good to have you here today.
Thank you so much, Fiona. I'm also excited to be a part of this and to participate with Gold Learning this year. And I'm so excited to share my passion with peers and to better support families.
Yeah, absolutely. And so we've had a chance to sit down and chat with each other earlier, and we've been going through your presentation, looking at all of that amazing content. So definitely, I've got the inside scoop to share with our audience here today. And of course, you're going to be talking about something I think that comes up. It's often. I think this is something that comes around with our families. So the topic title, of course, presentation title, Relieving Discomfort, Non-Prescription Cold and Pain Relief While Breastfeeding. So for our families, Nour, pharmacology, taking medications, it's tricky at best. There's a lot of misinformation. Even after all this time, there's plenty of resources out there, but we really need to be ready and prepared to share that information. It's our opportunity to educate our families. Of course, for a lot of us, we are non-prescribers, so we don't prescribe medication, but of course, we can provide that information that really can, set the trajectory of perhaps that parent, making a different choice and or having those really good conversations with their pharmacists and or with their family doctors. I mean, Nour, this is some of your life's work that you've done. Tell me a little bit, perhaps what you do on a day-to-day and where you are in the world, of course, which I think is amazing.
Yes, exactly. So originally, before I became an IBCLC, I specialized in pharmacy and I got my pharmacy doctor degree. And this is another subject I'm also passionate about. And I think it brought a little bit of an edge to my lactation consultancy in practice because I really advocate for my patients.
Mm.
I help them whenever they have any medical case. Of course, I do not prescribe, I do not change the medication, but I do prepare a lot of studies for them, the information that they can take to their physician and do the discussion with them. And sometimes whenever the physician is responsive, I also step in and I can do the conversation with them and the discussions with them as well. So I've been a pharmacist and a breastfeeding specialist before I became a lactation consultant in parallel since 2015. So it's been around 9 years now in both worlds. And it's nice to combine them together. So to talk about medication for breastfeeding mother, because we have a lot of lacking resources in this area.
Mm.
So even as a pharmacist, sometimes I struggle in finding studies that are reliable. Sometimes we don't find the studies and we do the conversation with the physician to switch to something else, maybe that is more studied and more reliable. And for the non-prescription medication, specifically in cold and in pain management, it's a little bit trickier because it's mostly what parents and families are used to getting from the pharmacies or what they are. Sometimes they're just available at home. These are drugs
Right.
that are available, that they have, that they are used to taking them before getting pregnant or before having kids. And sometimes they're just used to, like, whenever I have a headache, I have to take this certain molecule. Whenever I have a cold, this is my go-to drug or medication. So I found it's important to shed the light on this topic because sometimes since they are non-prescription, maybe families, they tend to self-medicate without really going and seeking support from healthcare professionals. So it's important for us as IBCLCs to shed the light a little bit around this topic and to know how to direct families towards alternatives or towards drugs that are actually compatible with breastfeeding and that they will offer support to this mother who is in need to relieve her pain and discomfort.
Well, of course, I absolutely love that. And I was thinking about how important it is to have a really good relationship with your local pharmacist, because I think this by far is something that is completely underrated. You know, when it comes to medications, we tend to depend on our physicians, which we don't always have access to. You know, it's accessibility can be a problem around the world, or you have to make an appointment, or, you know, if you need something immediate, having access to a pharmacy, you know, a pharmacist is really key. I want to choose you as mine now, just saying, Nour. knowing how passionate, yeah, we'll all be calling you. But truly, I've learned, you know, I've learned in my career and as a woman who breastfed, you know, how important it is to understand. And you know what's really interesting? Yes, I find that I don't know if it's the same for you. I either find there's these two sort of two extremes. Either, you know, my clients don't want to take anything because they are, you know, they would rather be suffering, or, you know, they're just so afraid they don't have the information, or they take something because somebody said it was fine, and then we find out it was something like a pseudoephedrine, you know, and their baby's a little bit older. You get that call, my milk is not, you know, my milk flow is slowing down, I don't know what's happening. And you find out that perhaps they've taken something, you know, earlier on prior to talking to you. So there's all these situations that still come up. And I think that, you know, clients not having the information, it's, you know, they don't have the conversation. So sometimes they just don't know what they don't know, right? So for you, Nour, tell me again, the interest of becoming an IBCLC. I don't think it's very common. I think there's a few of you in the world that I know who've become IBCLCs, but tell me, how did you get there? What were the things that took you to that new level of care?
So yeah, it's a very valid question. So I started actually as a volunteer in the community. I had some people in my family and around me that struggled with breastfeeding. And I started to get involved more and more in the community. I was still a student back then. I was doing my BS. And as I got involved, I saw that, like, as a healthcare professional, I did not have a lot of information. So it made me so sad because, like, I graduated from one of the top universities in Lebanon. It's a very good university, very reputable. But still, I felt that I could not really support mothers as a pharmacist and medications compatibility with breastfeeding, which is something very basic. And even beyond that, there are a lot of information that I learned through research about breastfeeding and a lot of challenges that could, like, the mothers with their contact with the pharmacist, with their doctor, pediatrician, gynecologist, family physician, they could have, like, just maybe reduced their challenges or overcame them in the beginning of their journey and saved their breastfeeding journey a lot. So it started from there for me, and from my lack of knowledge, actually. So I wanted to do more research. I loved it. I found a lot of amazing science behind it. So there's that, yeah. So I think when you talk in the community and you say you're a lactation consultant, they don't really know the how much science there is behind it and how much we study. And there is also the communication and the emotional part and the the reward that you are getting from helping mothers and succeeding and reaching their goals, because it's a really a nice feeling when you can be a positive change in someone's life, whatever their goal is, but
Sure.
for them to take an informed decision and for you to support them throughout this, it's really life changing. So
Hmm.
it started out of curiosity and some volunteer work and being involved in the community, and then I became like my passion grew each time I started doing more and more research, until like I did my first certificate, and then I put myself on the path to become an IBCLC, and here I am.
Oh, well, that is beautiful. Your passion is showcased, I think, during this presentation. Not only are you passionate, but breaking things down, to just to really see the different molecules, the different medications, the impact that they can potentially have. Having informed decision making is so important for our clients today, and I think as IBCLCs, one of the things that I've done, sometimes when I sit with clients, they're not even taking a medication, but they may consider taking one in the future. And so in order to say, I always say, you're welcome to call me back. And I've had those callbacks, months down the road. Fiona, the whole family's come down with a cold. I'm not sure if I can take anything, or I can't remember what we talked about. So I, like you, very passionate about making sure that people get the information that they need, that they can take it to their pharmacist, their doctor, and discuss the options. We talk about things even beyond that as well, of course, in our communities. Now, for this presentation, again, because it's so the common cold, you think, maybe they don't take anything, but you're right. People have things on hand and they have things in their cupboard, that they might just take. So it's really important that they have that information. Nour, thank you so much again. Your passion in this area really does. The knowledge translation that you give us in your presentation by far is one of the best I've ever seen. So thank you so much. And I know you haven't even presented yet, but we've had such a great time, working on this presentation and, getting to know each other. I know it's just going to be so beneficial. So for those listening in, guaranteed, come and listen to Dr. Nour. She's got so much to share about this topic so that you can feel equipped. And I think that's what you want to do. You want to be able to equip, our lactation consultants so that they can provide the information to the clients, right, Nour?
Yes, of course, like 100%. Like you said, a lot of medication are non-prescription medication are just available in the cupboard. And if you take it beyond that, like we said in the beginning, sometimes like a mother is just suffering because she thinks she can't take anything. And this would also impact her ability to breastfeed and to take care of her child when she's in
Right.
pain, when she's uncomfortable. It's
Yeah.
not something that she has to live with. And this is not what breastfeeding is about.
Absolutely. I couldn't agree anymore. We do not need any more suffering in the postpartum period. That's for sure. So thank you so much for joining me here today. I will look forward to having you at the live event. And of course, we'll have that great opportunity to sit down further for the live Q&A. So for all of you who are planning, or maybe you're just on the fence, you're ready to get your registrations in right now, you can head over to goldlearning.com, to goldlactation.com. You can check out all the information in there. So we have all the outlines, we have the handouts ready for you, so you get an opportunity to really find out what those presentations are going to be like. And also, of course, get them on your calendar. There's a nice schedule there for you as well, so you can get set up and ready to go. We can't wait to see you there. And I can't wait to have some more time with you, Nour. It's been lovely having you here today. Thank you so much for joining me.
Thank you so much, Fiona.
And thank you to you, our audience, for tuning in. We'll look forward to seeing you all again very soon. Bye-bye for now, everyone.